For those of you who don't know me, I'm an orthopaedic surgeon in private practice. I was an NHS consultant for 17 years. I loved looking after my patients, but I left when I couldn't take the bureaucracy and micromanagement anymore. It took me a while to realise that I'm not really cut out to be an employee. I'm a much happier person working for myself. Not long ago, I set up a group on Facebook. It's called Hip Pain and Hip Replacement Advice and Support for Patients. Catchy, isn't it? It provides an interactive forum for people to share their experience and ask questions. There are nearly 500 members. It's really informative and you should have a look at it. There's a link to it below. Someone from the US posted the other day, and what she said shook me. Keep watching and I'll tell you why. Here in the UK, we have our beloved NHS, and it's been looking after us for more or less 70 years. The founding principle of it was that treatment would be provided free at the point of delivery. Over the years, charges have been introduced for prescriptions, glasses and other stuff like care packages, but if you need healthcare, it won't cost you anything. We currently have very long waiting lists for things like hip and knee replacements, and people are understandably angry and upset about this. The pandemic badly affected the ability of the NHS to deal with its core activities, and it'll take years to catch up. It's the worst that I've seen it since I started at medical school a long time ago. The person from the US who posted on Facebook told me about how things work in US healthcare. It's an insurance-based system, so if you are working or have money, then you can access excellent quality healthcare. You might have to pay an excess charge called a deductible, but it depends on your policy. For older people and those on low income, then there are state-provided insurance policies called Medicare and Medicaid. They have a complex system of means testing and co-payments. The person on Facebook told me that the monthly premium for her family was $1,300 with a deductible of over $16,000. You have to pay up to this amount for treatment before the insurance kicks in. She said that many people go without care because they just can't afford it. Most of the developed countries in the world have an insurance-based healthcare system with a government-backed safety net for the poorest people. They use a mix of private and state hospitals and healthcare providers. The outcomes for serious diseases like cancer, strokes and heart disease seem to be better when compared to the NHS. But if you can't afford treatment, that's not much comfort, is it? The NHS has always been a political football with countless reforms and transformation. It's a bloated beast that is massively inefficient in many ways. You might have to wait months to see a specialist and maybe a couple of years to have a hip replacement, but you don't have to go bankrupt in the process. The NHS isn't the envy of the world anymore, and working for it wasn't easy, but we need to be very careful not to change it for something that isn't necessarily any better. Sooner or later, the government is going to have to change the way that the NHS is funded, and it's probably going to be an insurance-based model like everywhere else in the world. Let's hope that our politicians will have the courage and vision to do it properly. Thanks for watching.